Hi everybody, welcome to Chapter 7, Developing Customer Loyalty. The learning objectives of Chapter 7 are to understand the concept of relationship marketing, recognize the distinction between satisfaction and loyalty, describe the necessary components of a value-added service delivery system, and appreciate the importance and role of a recovery system. First, relationship marketing is defined as an organization's attempt to develop a long-term, cost-effective link with a customer for the benefit of both the customer and the organization. The foundation of relationship marketing is to develop a strategy that shifts the organization's thinking from the individual transaction, such as getting the patient to come to the clinic, to a relationship focus on keeping and retaining customers or maintaining their loyalty. Relationship marketing is more effective in industries where relationships are more critical to customers, especially true with the relationship between the physician and the patient. Customers may be characterized into four distinct groups: strangers, individuals in the marketplace with no relationship with the organization or medical practice in any way; acquaintances are a first-time trial; friends, repeated usage of provider, organization, or company should result in the organization gaining knowledge of the patient, referral source, or customer; and partners, where there is a significant level of trust in the interactions between the provider and the customer. This table shows the shift in focus from a transactional view to a relationship orientation. Here we see the different criterion, the transactional and the relationship different categories. Relationship marketing. Relationship marketing is a focus on what the customer is buying, not what the organization is providing, to become the provider of choice. Also focused internally by empowering employees to meet customer needs. And a quality focus beyond the clinical side of service delivery is a relationship marketing perspective that is most significant. Creating customer bonds are 4 levels of bond tie-in in a customer to an organization. First is financial. Monetary incentives such as lower prices for volume purchases or discounts for bundling services. Social and interpersonal is that at its core of the healthcare profession, where primary care physician knows his or her patients. Customization requires intimate knowledge of the customer, and structural bonds are the most difficult level of a relationship bond for an organization to achieve. These are accomplished by providing services to clients right into the delivery system. CRM, customer relationship management, is the acquisition, development, and retention of customers through the collection and sharing of information across the organization. Satisfaction or loyalty. Organizations benchmark depending on the measurement of programs. Healthcare tends to mirror other industries. They must aim for more than satisfaction, although the link to loyalty is strongest when satisfaction is high. Satisfaction does not necessarily translate to profitability because customer, although satisfied, may have a tendency to switch to other suppliers. The customer loyalty period is a progression of psychological commitment a consumer moves through. It has 7 stages from awareness to loyalty. Loyalty represents 2 key components: customer retention and the share of customer purchase. It is the isolation from the competing organization's pull that is the benefit of a loyal customer and goal of relationship marketing. Reduction in acquisition costs, which is a 5-to-1 ratio, meaning it costs 5 times more to acquire a new customer versus retaining a current one. Referrals, word of mouth, has a significant value within the healthcare industry. More tolerant if there's a problem, more willing to give the organization a break in circumstances when there is loyalty built. Creating customer value. The customer defines the appropriate service quality, and price level. Thereby, the customer defines the price-value relationship of the service. The difficult challenge in a competitive market is that this value is relative to competitive offerings. To a large degree, such as an equation shown here, can be developed for healthcare service value. Here we see clinical results produced for customer plus service process quality minus out-of-pocket price to consumer plus effort expended cost equals value to the customer. Clinical quality is a result of technical and expertise represented in the healthcare organization. Process quality represents the ease with which a customer can assess the clinical quality. Conducting a gap analysis. Researchers have identified 5 possible gaps. The first 3 we'll look at, then we'll see a graphical illustration, and then look at the last 2. The first gap is between expectations of service quality and management perceptions of customer expectations. 2, between management perceptions of customer expectations and service quality specifications specifications, and a third between service quality specifications and service delivery. Gap analysis is an approach to identify the gaps in effective service delivery as seen here. The figure shown here illustrates the service delivery gaps. First, the expectation and perceptions. 2, walk the talk. 3, resource gap. 4, promotional gap. And 5, the promise gap. The last two gaps are between the service delivery and external communications to customers, with the last gap being between expected service and perceived service. In order to measure service performance, it must meet 3 criteria. Measurement tool must be managerially useful. Tool must recognize the role of the customer expectations, and the tool must direct action to the most relevant areas. Looking further into the first one in developing measurement tool is to conduct a service blueprint. This is a graphical representation of the interactions among customers, employees, and organizational progress. The use of flowcharts to observe process and identify potential difficulties is very useful. Medical service blueprints is the operational process mapping of a patient's or other external customer's interactions with a clinical or medical provider. Your textbook also shows in figure 7.8 in the text a figure of a medical service blueprint. A customer recovery system is an organized system that anticipates services, delivery failures, or problems and provides a defined script for service people to respond to the complaints that arise. Critical components for implementation: focused recovery training must be conducted with all employees. Recovery standards must exist. An organization must be easy to complain to. Frontline employees must see themselves as part of the system. Employees need to believe they are part of a quality-conscious organization. There are 3 forms of treatment or fairness that customers seek from an organization. First is outcome fairness, what customers expect after they complain. Procedural fairness refers to the timeliness, rules, and policies of how complaints are handled. Interactional fairness is an interpersonal dimension of complaint process between the service provider and the customer. Customer recovery paradox: the overall level of loyalty of recovered customers is greater than those who did not encounter a service delivery problem. In other words, a customer's post-service failure satisfaction exceeds their pre-service failure satisfaction. Relationship marketing is a shift from a transactional perspective to the development of longer-term loyalty. In transactional focus, the perspective is more on what the organization is selling. In a relationship market focus, it is more on what the customer values. Satisfaction is not a sufficient goal for customer behavior, rather the focus must be loyalty. The customer loyalty pyramid has multiple stages: awareness, interest, evaluation, trial, repeat, satisfaction, and ultimate loyalty. The lower levels of customer pyramid are referred to as promotional levels. Loyal customers have multiple benefits in terms of reduced acquisition cost, longer term per revenue growth, more profitable to serve, able to refer others, and more willing to pay a price premium. Loyal patients have a broader zone of tolerance, are more willing to forgive an organization's service lapses. Customer value equation has 4 variables: clinical quality, service process quality, less out-of-pocket cost, and less effort expended. Conducting a gap analysis can help identify the opportunities for delivery of customer value. A service blueprint or medical service blueprint is a flowchart in each step in service delivery. A service blueprint highlights opportunities for establishing a differential advantage. Measuring satisfaction is a function of expectations and the importance of each point of contact. A customer recovery system is defined script that anticipates how to react when a problem arises in service delivery.